Hi everyone. I believe I'm the last speaker here today, and also the bar's been set really high. I lead public partnerships at Wellthy Therapeutics. Okay, great. So India's faced with a massive chronic disease burden. The numbers are really staggering. We have about 72 million diabetics, close to 1 million cases of stroke reported every year, 100,000 upwards transplants required every year. And the World Economic Forum estimates the global burden of chronic disease management to be about $35 trillion over the next 20 years. And just to give you a sense of where this number places in the larger context, this is about 6 times the amount, India's total health expenditure over the preceding 20 years. Now, the current system of care, of episodic care, is really not equipped to address this to address this disease burden at scale. The 1 hour that patients typically spend, So the 1 hour that patients spend in the doctor's clinic is not enough to equip them to manage their conditions in the 8,000 hours a year that patients roughly spend outside the doctor's chambers. And this is really the problem that we're trying to address. So to move the needle on outcomes, we thought that the focus really needs to shift towards demand-facing interventions that can enable patients to take charge of their own health. And that's how Wellthy Therapeutics was born, to augment the current healthcare system's capacity to address the chronic disease burden at scale across millions and millions of patients. And now to the critical question of, sorry, I'm really struggling with this. Okay, and now to the critical question of how we do this. So we work as a complement to the existing standard of care. So a patient receives a prescription along with their regular medication for Wellthy Therapeutics. A patient can access Wellthy care either using a QR code which is placed in the doctor's clinic, or by purchasing an access code that allows the patient to enter the Wellthy Care app. And the idea is the usage of the app as well as prescription-grade medication together leads to better outcomes. And the exciting part is that all of the patient journey data that was previously completely unavailable to healthcare providers now becomes accessible to doctors, to paramedical staff through dashboards, and can be used for decision support and medication titration. So essentially, better data helps all stakeholders in the healthcare continuum to improve outcomes. And this entire process is powered by our proprietary digital therapeutics platform, which comprises of patient-facing smartphone applications, dashboards for physicians, for paramedical staff, for nurses, for health coaches, for therapy design, as well as an AI-powered chatbot that can be deployed across multiple mediums. So since our inception in 2015, about 4 years ago, we've validated our outcomes in about 13 plus clinical studies. And across each of these studies, we've been able to show a mean reduction of 0.51% in HbA1c. So HbA1c is the gold standard for measuring the level of blood glucose over an extended period of time. We've published and presented these results. We've presented them to peers in the global medical fraternity at the ADA, at the ATTD, the IDA. We've published these results across leading national and international journals, such as the Diabetes Technology, Therapeutics, Diabetes Care. And based on all of our clinical outcomes, we've actually been endorsed by the RSSDI as a prescription-grade intervention for chronic disease management. The RSSDI is Asia's leading body of diabetes research and healthcare professionals, and we've been recognized by the American Diabetes Association as a global thought leader in this space. So based on our clinical outcomes, which we spent the greater half of our journey actually validating and trying, we were now live with over 300 physicians in clinical systems in India. And we're seeing fantastic results across our expansion. And the most sort of heartening part of our entire journey is the patients we've been able to impact. We're actually now working with, we have 7,000 patients live on the platform today, and we've seen very positive and fabulous results from them as well. So moving forward, we're deployed now across multiple partnerships through multiple channels. Just to give you some examples here today, we're working with, we're as of November 2018, we're co-packaged with Roche Diabetes' flagship AccuCheck active brand of glucometers. These are very widely sold across India. So now every glucometer sold across the south and west of India comes powered with an activation code for Wellthy Therapeutics. So patients can, when they buy the glucometer, get access to our app as a companion therapeutic. We're now inscribed into the standard of care of one of India's largest hospital chains, which is a Wockhardt chain of hospitals. Across all of Wockhardt's hospitals, they're prescribing physicians and endocrinologists and diabetologists actually prescribe Wellthy Therapeutics on the prescription pad as a part of the standard of care. And finally, and sort of the most exciting part of our journey is the way we're able to work with pharmaceutical companies across India to actually co-package digital therapeutics with sort of physical pills to improve outcomes across millions and millions of patients. And now we're moving towards adding public sector partnerships to our pipeline to achieve our goal of being able to transform the standard care for chronic disease management at the national level in India, at the policy level. And this is sort of the where we would love to receive help from the innovator community to be able to help us realize this dream. We're really built to scale across mass markets in India. Today we're live in Hindi, and we will be live in 7 additional regional languages over this year. We're also built to reach affordable price points at scale. So today we're able to deploy at ₹1 a day, which for a 16-week program is about 112 rupees, which is less than $2. And to give you a sense of PPP, it's about the price of a movie ticket or less in India. And just before one thought to leave you with before I walk away: digital therapeutics is a growing industry globally. It's poised to reach about a $9.4 billion industry by 2025, and we're really pioneering this category of medicine in emerging markets. So thank you all for your time, and really look forward to interacting with you over the next couple of days.